opportunity to update you on where we are as it relates to current transmission case rates, positivity rates, hospitalization rates here in the state of California, particularly now as we move into this new phase where we brace, where we prepare ourselves for what is inevitable now based upon the movement, based upon the travel we have seen just in the last week, and expectation of more of the same through the rest of the holiday season, of a surge on top of a surge, arguably on top of, again, another surge. More on that in a moment, but I just think we'll start with the case date rates and case number updates. You can see here from this slide, trending slightly below the 7-day average in terms of new case numbers, new transmissions of COVID-19, 33,170 reported over the last 24-hour period. 37,661 is the 7-day case rate number. Take a look. Slide very familiar to many have tuned in the past. This is the positivity rate. This is on the basis of in the last 2 weeks. This December testing number is an entire month testing data so far to date. We've seen a 67% increase in the average number of daily tests just month over month. We expect to continue to see a rate of growth in the testing in the state, and that's a point of pride, and it's also a point that needs to be emphasized. More testing, more surveillance, more accuracy and understanding of community spread, more case numbers, certainly, but a much more honest assessment of where we are in this state. Less testing, less data collected, less understanding of the virulence of this disease as well as the spread of this disease. You can see the spread into the hospitals now. We're experiencing just around 20,000 patients that have been identified as COVID positive, 19,766 to be exact. You can see a 38% increase over the 2-week period. That's actually more modest than we've seen in terms of an increase over the last month or so. We're seeing now a majority of the state experiencing a plateauing of new hospital admissions. So majority of the state actually seeing that rate of growth beginning to subside, with one major exception, and that's Southern California, that continues to see higher case rates, particularly Los Angeles, but also San Bernardino, part of Riverside. As a county, those three remain the most impacted large counties in the state. You can see in the ICU admissions, similar trend lines, a growth along the lines consistent with the hospital admissions. Growth rate, though, again, that's plateauing modestly. 4,228 individuals now admitted into our ICUs that have tested positive for COVID. But again, none of us live in the aggregate. The plateauing is in the aggregate. Regional by region, you're seeing a completely different story. And this is a slide that I think sums it up. In Southern California, that ICU capacity, San Joaquin Valley, the ICU capacity is effectively zero. Both regions are in their surge planning on ICU, and in many cases, that surge planning is substantial. In other cases, it's certainly in that next phase. The Bay Area, not yet in to the surge phase at 9.5%. The greater Sacramento region still hovering a little bit above the 15% at 16.6. And of course, Northern California, up near the Oregon border, we are seeing ICU capacity that's reasonable at 29.3%. Not where you want to see it, but certainly not the experience in that part of the state, in Southern California and in San Joaquin Valley. We have initiated, you recall, these stay-at-home orders were part of a 3-week regional stay-at-home order when the ICU capacity trended below 15%. Remind you, San Joaquin and Southern California stay-at-home orders were the first to be enacted, understandably so, based upon the ICU capacity you just saw. That 3-week period is and now Southern California to expire orders both in San Joaquin and Southern California, understandably so, based upon the ICU capacity you just saw. That 3-week period is now due to expire both in San Joaquin and Southern California, begging the question, is it going to be extended? Well, self-evident, 0% capacity in San Joaquin and in Southern California. That likely is the case, but I'll remind you, when we conceived of this framework, we are looking at projections 4 weeks out. We are looking at current case rates, positivity rates, looking at the community surveillance that we're doing and anticipating based upon our modeling where that growth will be over a 4-week period. Based upon the data that we will collect today, Dr. Galley and his team likely tomorrow will announce, and that's why you see on this slide the 12/29 announcement. They will announce, once today's data is collected, their projections over the next 4-week period. It is clear and understandable that it's likely those stay-at-home orders will be extended. But again, based upon the data, that determination will be made, and based upon the data that needs to be collected today to complete that 3-week period, Dr. Galley will update you tomorrow on more specific projections. We see the greater Sacramento area and the Bay Area, those stay-at-home orders, the 3-week period due to expire on January 1st. In Sacramento, we'll update you after the beginning of the new year, where greater Sacramento area and region are based upon their 4-week projections, and the Bay Area a week later on January 8th, and we'll update. That's the conclusion of that 3-week stay-at-home order. We'll update you on those 4-week projections moving forward around that date as well. Look, as it relates to Southern California hospitals, that's been our biggest focus. It's obviously generated headlines, it's generated a lot of focus and consternation, not only within the region, but throughout the region, throughout this country. And I'll talk more about that in a moment in terms of the support and mutual aid that we are receiving. But you get a sense here from this slide, the magnitude of what we're up against, particularly in Southern California, particularly in Los Angeles County. Look at LA County alone, 12 to 15,000 cases a day just in the last few weeks. It's obviously having a big impact, taking a big toll on our hospitals, not only in terms of hospitals proper, but obviously ICU and the impact in terms of the acute care, as well as just general emergency care within the system. 96%, let's underscore, 96% of LA County hospitals were on diversion. And that's, in essence, when you can't accept ambulance diversions, you can't accept the ambulance for acute patient needs, they're diverted to another part of the system, another part of the county, or another part of the region. 96% of LA County hospitals were on diversion at some point over this weekend on Saturday. Typically, you'll still see ambulance diversions, but 33% pre-surge. That's in a COVID environment, pre-surge. 33 to 96%. That's Saturday's specific numbers. We use that just to illustrate the pressure now we are experiencing in terms of the system, particularly the hospitals in Los Angeles County. On average, and this number is sobering, on average, LA County hospitals spent 2/3 of their day, or 16 hours, on diversion, just 8 hours when they weren't on diversion. That's on average. Again, just underscoring a finer point of the magnitude of the stress now in the hospital system in LA County. Again, routine emergency room care is being slowed down. So if you think this doesn't impact you, if you think somehow you're immune from impact of COVID, there's the direct impact, and that is the transmission of this virus. There's the indirect impact. God forbid you have a stroke or heart attack, you have a car accident, or you have other acute care needs. The impact of this virus, this pandemic, is being felt on the entire hospital system. And that impact obviously could impact each and every one of us, God forbid, that we're in need of emergency care, particularly now in LA County. So as a consequence, we have been supporting through mutual aid, and we'll update you on some of those efforts on staffing that we've been deploying over the course of last many, many months, not just many, many weeks, since this third wave and this new surge that we have experienced. But we've also been working a little bit more prescriptively over the course of the last week to really target the needs within the hospital system. You have large hospitals, large systems, you have smaller hospitals. Each one is a unique story. Each hospital within each county, within each system, tells a completely different story in terms of stress and impact. So we sent a number of teams down. We visited a sample of the hospitals, large and small, to really understand what are the most important acute needs. Staffing, obviously, top of mind, but what other supplies, not just PPE as it relates to masks and gloves and gowns and face coverings, but oxygen, other needs, ventilators. And we have now been able to take that information, which we garnered over the course of the last number of days, and we are now sending a new team that we're embedding now full-time the county in LA County to encourage load leveling and to encourage greater coordination between the hospitals. What I mean by load leveling is some hospitals are at 130%, some are at 70%, some are just down the road from one another, and some have completely different patient mix based on socioeconomics, based upon a myriad of different issues. So looking at load leveling in a more coordinated and collaborative manner, not just within the county, but more regional and obviously with the state, and drawing down our federal partnerships. We're also looking at contingency care planning based upon that same consideration, same strategies. And this new team that's been embedded down in LA County is EMSA team, CDPH, Department of Public Health, obviously Office of Emergency Service, OES. We have now deployed into 116 facilities in the state of California, 1,000 plus staff. In fact, 1,028 staff have been deployed through myriad of strategies, be it the Health Corps, be it the California National Guard and their cohorts of teams, spectrum of folks, over now 1,000 staff that have been deployed throughout 116 facilities. We also have staffing waivers. That's looking at flexibility, looking at really stretching resources. And again, absolute expression of admiration and respect for our nurses that are asked to do more with less staff and less support. It's heroic, and that needs to be acknowledged. Those staffing waivers put intense pressure on that workforce, on those individuals. And I just want to express our appreciation to each and every one of them working through the holidays and through these difficult times, particularly with these staffing waivers, now 86 waivers approved statewide. Federal resources, again, we're pulling down more federal resources. We had good news on the HHS, the DMAT teams. These were, again, looking to be redeployed from Southern California, primarily Imperial County area. We've got a new team arriving this week, arriving today, which is very, very encouraging, as well as we're seeing 75 personnel from that work. We're doing the efforts to get more DOD staff, Department of Defense staff, these 10 teams that we requested, 200 folks. We got those first 75 now being coordinated, getting ready for deployment in the next 24 to 48 hours. So more resources being requested from the feds. We've updated you last week on some of those specific requests. Just here's an update in terms of some of the requests that have been granted and have been supported. Additional work that we've been doing, just to update you as well on these alternative care sites. We have close to 2,000 beds, arguably more than that, 1,872 that would be warm beds ready to go within a 72-hour to 96-hour period, some even earlier. You can see of those facilities, those beds, number already being utilized. Here we have open, no longer warm status, but we've stood up these alternative care sites, strategically deployed throughout the state of California, Imperial Valley College down in Imperial County, obviously Sacramento Sleep Train, Porterville, Fairview, and then a new alternative care site that has not yet taken patients, but now beds are being stood up. But you can see 67 patients now in these facilities, helping just modestly at this stage, to decompress the rest of the hospital system. But as we stand these up, our capacity is substantially greater. Just as an example, Sacramento Sleep Train Arena, well over 200, 220, get up to almost 250, potentially even more in that one facility. Number of patients, they're just at 11. So we're getting these sites up, operational. Key again is staffing. It's one thing to have the site, it's another to have the beds, another to get the staffing, and that remains, again, with all the issues that are compounded in stacking, the top issue as we work through this very challenging time. But nothing more challenging or nothing that underscores this challenge more than the total number of people whose lives have been lost. And this is devastating. These are lives lost quite literally in the last number of days over the holiday season, Hanukkah, Kwanzaa, and obviously Christmas. 64, and that's a reporting. Every Monday I say this, 64 never tells a story. Those are reporting lags based upon the weekend. 230 is devastating. That's the average number of lives that have been torn apart and families have been torn asunder on average over the course of the last 7 days. Just last 14 days, 3,238 lives shattered, lives lost to this deadly disease. And let me just give you an update on what we're experiencing in terms of just the data we've collected on how deadly and who is most impacted in terms of morbidity and mortality. Here you see just from October 1st, 65% of the ICU admissions have been a cohort of people 61 or older, but 80% of the deaths in that age cohort, 61. 60 is not that old. 61 is not that old. 61 plus, 80% of all the deaths in just that age group. This is more contemporary data, culled just since October 1st. That's why today we're pleased to announce a new partnership, a pharmacy partnership working with Walgreens, working with CVS. This new federal pharmacy partnership will allow the vaccination beginning today of our most vulnerable Californians, particularly in our skilled nursing facilities. There's 2 phases of this pharmacy partnership that's focused primarily on the skilled nursing facilities as the first cohort of focus. We're going to use the first phase of the Pfizer vaccines. We're going to take from that allotment a percentage. This was all part of our Plan 1A, our drafting of our vaccine guidelines. This is all part of that existing public plan. We'll use those doses, a percentage of those. They'll be sent directly by the feds to the pharmacies. The pharmacies will begin that vaccination protocol. Again, the skilled nursing facilities, the SNFs first. Their Part B, their second phase of the pharmacy partnership, will be assisted living facilities, residential care, and other long-term facilities. Just to put it in perspective, so you get a sense of the cohort, the size, it's about 1,200 SNFs, 1,200 skilled nursing facilities for the first phase A, that we will be advancing in partnership. You can see the breakdown on this slide, 499 facilities working with CVS and 357 working with Walgreens. You'll also notice that that does not add up to 1,200. The pharmacy partnership is for every part of the state with the exception of LA County. There's a little differentiation in LA County, Pasadena, Long Beach, but LA County was committed to their own strategy, not in partnership with the pharmacies. They're doing their direct allocation, staffing, support, and distribution of the vaccine into their skilled nursing facilities. So this is for all of those outside of LA County, again, with the exception in Long Beach and in Pasadena. Let me just give you a little bit more of a detailed understanding of what that partnership looks like. They're going to administer the vaccine by their staff, pharmacists, technicians, pharmacy technicians. We did a waiver on that. They're going to do scheduling, coordination, all the on-site work, all the associated supplies will be done by this partnership. So we're not pulling, I guess it's a way of importance of this slide is just to say we're not using our existing staff. This is why we went into this partnership with CVS and Walgreens, is the scarcity of staff. We didn't want to use staff for key supplies and pull it away from our other efforts. So that's why this partnership is so important. We hope as impactful as it's being promoted. Again, this begins today. They're doing all the reporting, all of the cold chain management, the whole logistics supply, the whole thing, all done by CVS, by Walgreens. This is happening, by the way, in many other parts of the country, not unique to California. We're just announcing today that it is starting. Let's update you just briefly, and we'll take questions here in just a brief moment. Last week, our Community Vaccine Advisory Committee met to discuss the next phase of vaccine distribution. I'll remind you, we're in the current phase, phase 1A, which is prioritizing, as I just updated you, skilled nursing facilities, congregate care facilities, and our healthcare workforce. They put out that plan, and we are implementing that plan, and this pharmacy partnership is part of that plan. Plan 1B and Plan 1C are very hotly anticipated, forgive the phrase. Everybody's wondering where they stack in terms of that plan. They're not healthcare worker, if they're not in a congregate facility or a skilled nursing facility and the like. So that's Plan 1B and Plan 1C. Last week, there was a very public forum, and I'll remind you, we have a guidelines work group that does the technical work, 16 members, and then you have this 60-plus member advisory committee, this community advisory committee that then has a public dialogue discussing the merits, demerits of that drafting work group plan. That is, again, on our covid19.ca.gov website, covid19.ca.gov website. And you can watch the next cohort being discussed. You can watch the drafting guidelines work group presentation, and you can get a sense of the dynamic, the dialectic in terms of that conversation, the really looking at populations and subpopulations. So let's take a look at what they discussed last week in case you didn't have a chance to tune in. So here's the phase 1B, the next phase. This is next month, we hope. And this is what's under consideration. This is what was discussed last week and what we believe will be finalized as early as Wednesday. And so last week, this was what was discussed. Plan 1B, 2 tiers. You remember on our Plan 1A, there are 3 tiers. If I've lost you, you're paying attention. If I haven't lost you, you might not be paying attention, except to say there's populations, top line, and there's subpopulations. There's prioritization, and then there's categories of prioritizations within those priorities. And so this is a slide that simplifies that a little bit. And these are Plan 1 and B folks. These are high-risk individuals that live in high-impact geographic areas that obviously can impact the spread to their coworkers and or the public. That was at least the sentiment from the drafting guidelines work group, to which was the thrust, the value proposition that went into the phase 1B guidelines. 75 and over will be the top sub-priority in terms of population. Workers in education, that's our teachers, but across the spectrum. Workers in education, childcare, emergency services, food and ag, the food supply chain. And that's farm workers, grocery workers, the logistics around food, the essential workforce we've counted on that's been there from the beginning of this pandemic, that's paid a huge price in terms of impact, in terms of spread, in terms of mortality and associated health costs since the beginning of this pandemic. So they will be prioritized in the phase 1B, tier 1. Tier 2 is 65 and over with underlying health conditions, people with issues of obesity and diabetes and the like. Workers, again, in transportation, logistics, commercial sectors, critical manufacturing. We get into high-risk incarcerated individuals, homeless, and the unhoused. Phase 1C. This is under consideration. They'll be discussing this on Wednesday. They'll be approving 1B, we hope as early as Wednesday, unless there's some deviation from the current schedule. But Plan 1B should be locked down on Wednesday. Plan 1C will be discussed. That's the next phase, and that's what I wanted to socialize and provide for you, a little preview of that. And this gets to folks 16. This may include many more people watching. 16 to 64. This will include someone like myself. 16 to 64, people with underlying medical conditions. Workers in water, waste management, defense, energy, you can see on this list. Community service providers, IT, financial services that, again, are high impact. So that will be part of the conversation. The advisory committee will discuss this preliminary Phase 1C plan. They'll make adjustments. We'll make accommodations, because we're getting a lot of people lobbying, a lot of people providing insight. IDD community, which is developmental disabilities, individuals, developmental disabilities that have higher, those are impactful subpopulations, and people are coming in, making sure that we don't forget critical populations in the state. Again, all with an eye on equity, all an eye on regional equity, not just racial and ethnicity, social economics, always considered as well. And so that's the plan for the Vaccinate All discussion this Wednesday. And again, hope you tune in. Again, if I've confused you, you can have a more simplified version of all this this Wednesday on the covid19.ca.gov website. Let's talk more now about what's been done to date in terms of the vaccines that have arrived in the state and the vaccines that have actually been distributed. So let me update you on the current status of Moderna. The Moderna doses of California, we anticipate by the end of this week that we'll receive all 904,900 doses of the Moderna vaccine. We received the first allocation of 672,000 plus doses, and we anticipate 232,000 plus doses by the end of this week. So 900,000 Moderna doses by the end of the week arriving in the state of California. 858,000 Pfizer doses also anticipated to be in the state by the end of the week. We've received the 327,000, that first allocation that got a lot of attention. That second allocation that got attention because it was a little bit smaller, 40% than what we had anticipated. 233,000 that we received, and now in anticipation, 297,375 doses by the end of the week. So you add those up together, and that's 1.76 million, about 1.8 million doses we anticipate by the end of the week. You may recall in some of our early assessments, we were looking at the end of the year for planning purposes, and we were very cautious when we talked about this. We said these are for planning purposes, and these are just estimates, and it's likely we're not going to see these estimates as accurate as we would otherwise believe them to be. That's indeed turned out to be the case. It's not a point of criticism. I still think it's an extraordinary success story, and I want to just thank everybody associated with Operation Warp Speed. Thank you from the bottom of all our hearts for this heroic effort to get these vaccines into our state, into patients' arms all across this country. For that matter, the impact those efforts are having around the rest of the world. That should be acknowledged. That 1.76 million is a little shorter than the 2.1 to 2.2 million that we had anticipated by the end of the month, but not by a huge factor. But nonetheless, we're hoping to catch up. We're hoping to see more of these doses arrive in the state. But 1.76 million is what we anticipate by the end of this calendar week. Here is the update on the total number of vaccines that have actually been administered. These are the Moderna and Pfizer vaccines, 261,672, 262,000 doses have been administered. And by the way, this number trails a couple of days. It's just a little bit of a report lag, particularly over the holiday, particularly after Christmas. These numbers go through 12/26. So that number is certainly well north of 300,000. And you're going to see it's more like a flywheel as these things arrive, spoke and hub. You then deliver these out, more rural, remote parts of the state. Then they prepare the distribution, additional sites for distribution. And so we'll start to see these numbers begin to significantly stack up and significantly get greater. I look forward to updating these numbers in the next number of days, just as a proof point that we're going to start seeing more in that space. Speaking of more, and I'll close with this, and we'll open up to questions. Dr. Galley's with us, of course, here today as well. We are pleased that more was done to advance the cause that unites, I think, all of us across this country, across the political spectrum, and that's to get support in the hands, money in the pockets of those most in need, particularly those with food scarcity, those that are paycheck or two away from losing everything. And despite our efforts on eviction moratorium, forbearance, and other related issues across the spectrum, those pressures still are real, and they're stacking and they're amplified, and they're made even more raw and emotional during the holiday season. So good news, finally, the president signing this COVID relief bill. Just remind you of what it does, and hope and expectation we'll do a lot more. But here's what it does: $600 to qualifying individuals, $600 per child for eligible families. That's the child care component we updated you on last week. The unemployment enhancements continue another 11 weeks. SNAP, that's food stamp, the old vernacular, 15% increase in the nutrition program that's so critical for another 6 months. That's going to be key. The rental assistance package, also key. That's across the spectrum, across the country. A couple $2 billion, a little less than that, be arriving here in the state of California that will provide critical relief. And we're hoping to move very, very expeditiously, working with the legislature to get those dollars out. The pandemic expansions include the PUA. That's the unemployment insurance, but for people that are the pandemic unemployment assistance that are self-employed or part of the gig economy, et cetera. And that's extended through March. And the PPP program, the Paycheck Protection Program, that gets reopened for small business, fundamental, critical. This on top of the $500 million of small business grants the states just put up, the $100 million of hiring tax credits we put up, the billions of dollars of abatement and extension on sales tax collection, and all those other small business grants and loan programs that we also stood up at the California iBank, et cetera. I encourage you, any small business man or woman watching, if you run a cultural institution, if you're a nonprofit, learn about accessing these $25,000 grants by going to the COVID-19.ca.gov website. We're going to be doing much more for our small businesses in January, but this was this transition fund that we put together with the incredible support of the legislature. And we look forward to advancing that support and partnership and make some big and bold announcements to help our small businesses with the legislature in the next number of weeks. You can see as well, there's some paid sick and family leave benefits that are also critical, that are also being extended, both the federal and obviously the work we've done here in the state. And so with that, as always, we encourage you to minimize your traveling, minimize mixing. This is an anxious period for Dr. Galley, for health officers all up and down the state, hospital administrators, all of our incredible frontline staff, because of the expectation that while we've seen a plateau and while we're seeing some good news as it relates to hospital admissions and ICUs beginning now to slow down in terms of the rate of growth everywhere outside of LA in particular, though again, in parts of San Joaquin and certainly highlighted in San Bernardino, Riverside counties, that we likely will experience in 2 weeks, 10, 14, 18 days from now, this surge stacked on top of these other surges related to holiday activities. And so we're doing everything to prepare our staffing, alternative care sites, and to really be vigilant in terms of our promotion of alternative strategies as we wait for the vaccines to mitigate spread, new PSA campaigns, which we hope you're seeing up, new billboards, new messaging, in-store messaging in grocery stores, as well as more culturally competent messaging on social media to connect with people. All these non-pharmaceutical interventions, meaning mask wearing, meaning avoiding mixing, the like, are critical at this juncture to, again, make these models mute and to bend this curve and not allow us to just be victims of fate, to be able to bend that curve by taking actions that can mitigate the spread and ultimately help expand our capacity in our system so that we can weather a very challenging January and challenging February and look forward to moving into that second quarter of this year, more vaccines, and begin to get on the other side, that light we talk about at the end of the tunnel, the other side of this pandemic. So with that, and we're on the other side of the presentation, and we're happy to take any questions.
Jill Cohen, New York Times.
Hi, Governor. Thanks so much for taking the time. I wanted to ask a little bit about enforcement, as we've sort of seen so many examples of businesses openly defying stay-at-home orders, advertising New Year's Eve specials and events. I'm just hoping you can kind of shed a little light about what the state is doing to counter that kind of activity, and specifically if the state is planning to take any action against Orange County and Riverside counties, two of the most populous and hard-hit counties where the sheriffs have said that they will not enforce the restrictions.
Well, it's one thing to say you're not going to enforce them. It's another to have a county policy by their county board of supervisors to move in defiance. And we have a well-established protocol, if that's indeed the case, that the distribution of these discretionary COVID dollars will be distributed to counties that are serious about enforcement and are serious about public health. And we have, as you know, sent letters out to a number of different counties over the course of this pandemic, and we have leaned in on that. As it relates to the issue of enforcement, we've also leaned in on enforcement, new guidelines, operational guidelines through OSHA, new updates in terms of some of their latest enforcement. I'll provide you offline some details to back up some of the recent enforcement, particularly in the food processing industry. We updated last week, and I'll get you some updates on the numbers we provided last week at the ABC, the Alcohol Beverage Control, and their number of visits, tens of thousands of visits over the course of the last number of months to bars and restaurants all throughout the state of California. I think the remarkable thing is how overwhelming the enforcement well, I should rephrase that. I think what's significant is how overwhelming we have experienced, and forgive me for not phrasing this correctly, but people have been in compliance, overwhelmingly so. That's the point I want to make. It's not just the focus on the bad, it's the overwhelming number of people that are doing the right thing. And I think you'll see that, and we'll again provide you an update on the numbers we socialized last week to sort of prove that point, that the vast majority of these visits, overwhelming majority of the visits, there was no compliance needed because people were in compliance, they were doing the right thing. But there are notable people that are not, and they're thumbing their nose and they're putting their business at risk. And you're seeing that there's a lot of local enforcement that is taking shape all up and down the state of California. And there are
Laura Corte, Sacramento Bee. Hi, thank you for taking our question, Governor. In regards to, again, getting those COVID dollars to compliant counties, what are you doing in the budget to further incentivize counties who maybe haven't been complying with those state guidelines?
Well, I think we've done it. I mean, the bottom line is the rules are self-evident. If you refuse to comply, you thumb your nose at the health of your constituency, the health of your community, then you're sending a message, two messages. One, you don't care about the health of your community in that respect. But number two, that you obviously don't care to get the support from the state as it relates to those dollars. And so we've worked with CSAC, that's our partners, the counties, We developed a framework, a guideline. We worked over a month-long period to work out the nuances of the language with CSAC on what that enforcement looks like, what the notification looks like, and so we're looked to advance those. By the way, those work through formally that partnership in terms of those notification requirements and distribution and redistribution of funds to the end of this calendar month, and we'll update those as we move into the new year, pursuant to your question, and be as aggressive or more aggressive into the future. Not everyone likes that, and some have been particularly critical, and I understand that. Good people can disagree. Some people just want to be disagreeable. Bottom line is, we're in the midst of a pandemic. I don't know what more evidence you need, particularly as highlighted Riverside County, that is experiencing what they're experiencing in ICUs and hospitals and lives lost. I mean, what more evidence do you need that trying to enforce good behavior will actually save lives? It's a noble and right thing to do, to dismiss, as many have in the past, and some of the same folks that, we don't believe that, some still holding on this as a hoax, or face coverings don't matter, continue to send missed messages. They're not helping. They're not advancing that cause. And so we will be assertive as we have been. We'll be aggressive as we have been, and we will be proactive into the future in strong partnership with the California legislature.
Angela Hart, Kaiser Health News. Thank you, Governor. Two-part question for you. First, can you give us any indication of whether people largely heeded the orders to not travel, to stay home during the holiday, or I guess we're in the middle of it, so are they heeding these orders, or are these orders going ignored right now? What's your understanding of that? And second part is looking really at this, the impact on local governments and the immense responsibility that local governments have. I wanted to ask if you're going to do anything more in your January budget for local health departments, given that the federal COVID relief package includes no new money for local governments, and that's going to complicate their public health efforts.
We've got a lot of resources that will drive through directly down to the county and local level that come from this COVID relief. May not be spelled out as local support or even state support for that matter, but substantially will draw down in terms of the partnerships and the capacity building that have been well established since the beginning of this pandemic, efforts in terms of logistics and operational challenges associated with administration of doses of vaccine, as well as other testing protocols. Those supports are not insignificant, and those supports will be spelled out in the January budget, as they have been spelled out in this new COVID relief package. That includes, by the way, substantial support for public education across the spectrum that will provide a lot of relief to communities that have large school districts, and other relief that obviously will directly impact local communities, from child care relief and food stamp relief and other relief that otherwise would have fallen as a burden on county budgets, on city budgets, and obviously on state budgets. And by the way, that also includes rental relief. So all of that reduces the stress and burden on these governmental agencies, and certainly something that we celebrate, and something that I think should be acknowledged with this federal support. While we're disappointed they didn't provide discretionary funds as it relates to state and local support, there's certainly a lot of state and local support that is being provided in the CARES Act and this now new stimulus. As it relates to the data on movement, this is health travel advisories that come from health agencies all across the country, from the CDC on down. Every state is providing the same. We'll get you updates, and I'll make sure my team gets you offline. The updates, we provided this, I think it was 10 or so days ago. It's actually, you're prompting, it's an opportunity to provide some of that cell phone data that's public data, open source data that gives us a sense of some of the movement, and we'll get that data to you. But obviously, look, you need nothing more example than the total number of passengers on airplanes nationwide that only suggests that we are going to see an increase in cases across this country, not just in the state of California, as it relates to these travel advisories that were not heeded clearly by everybody.
John Thompson, Associated Press.
Good afternoon, Governor. Wanted to first check on your status. Have you been tested since your possible exposure? And as far as you mentioned on the travel and cell phone data, but do you have any more specifics at this point? What we're seeing here locally, even if you don't have it at your fingertips, is there data to suggest that people did or did not comply? And can you go into any more details as far as, where will you be putting some of these people? You mentioned more generally about surge beds and state facilities, but any specific plans for how to handle what you expect to be, or has expected to be, a doubling of hospitalizations? Thank you.
Yeah. So just on that front, we'll provide you, we'll get you the update. And I promise you my team is already working on providing that travel update, and we'll get you more specific, more granular response in terms of whatever evidence at this stage that we can share or that tells a real story. So we're not just working through conjecture and just loose observation. As it relates to the planning, over the course of the last number of months, you've seen, going back to the beginning of this pandemic, in early March, April, May, you saw some of the plans that we put out as it relates to capacity building within the existing hospital system, looking at existing hospital footprints, looking at surge capacity, getting thousands and thousands of additional hospital beds on the same footprint by getting tents and providing opportunities to reconstitute and repurpose different rooms within the existing hospital and healthcare delivery system. In addition to that, we also have been updating you pretty consistently, including a little bit today, on those alternative care site facilities, 5 that are no longer in warm status that have been stood up, and another, 8 specific, or 7 rather, specific sites that are in warm status that could be turned on very, very quickly. I'll update you, and we'll make sure our team provides you that list of those 7 additional sites plus the 5 and more details on their total capacity, which I suggested was around 1,872. But with our capacity building in the last couple of weeks, we think go well north of 2,000 beds. Just again, that's the alternative care site footprint. You've got the existing surge plans within hospital systems that get you tens of thousands of additional beds. All total, that is a direct response to your question in terms of the immediate staffing is the bigger issue. Physical, less of an issue, though an issue, depending on hospital. Again, each hospital tells a totally different story. But in the aggregate, the physical space is less of an issue. It's an issue, but it's less of an issue than staffing. And staffing remains our top priority. That's why we highlighted a little bit of our staffing efforts today. But long-winded, Don, so sorry for being long-winded. We have plans. We are engaged with the hospitals directly on those efforts by system, by provider, not just the hospital association. But with that, let me just ask, perhaps more cogently, Dr. Galley could also amplify and answer that question. And then I think this is an opportunity for Dr. Galley, as I turn it over to you, for us to update some of those older plans so we can socialize what we've been talking privately to our providers about.
Yeah, Governor, thank you, and thanks for the question. I'll sort of provide three types of responses. First, as it regards to travel and the impact of the regional stay-at-home orders and other things that, we always knew we were going into a tough time with the holidays, and the interest and the eagerness. We've talked about fatigue to actually meet and mix and travel. And, in most of the state, we are seeing a subtle but important trend where the slope of our increase that we've been very worried about, that rate of rise, has come down a little bit in some parts of the state, and that's reassuring news. But as the governor has clearly stated, we're worried not just about what's happened over the past couple of weeks, that piece of good news, but really what's going to happen as we see the cases from the Christmas holiday, Hanukkah, coming up now with the New Year's celebration. And I'll just reiterate, it's not too late to make a change in plans. I think Californians have been paying attention. We saw maybe a month ago that only about 30% of Californians that were surveyed by some of our partners were going to make a change in their plans to not gather, to not travel. Now, more recent surveys show that that number is somewhere between 50 and 60% of Californians making that decision. So we really hope that as we enter one of these last worrying periods for the foreseeable future with New Year's, that people do make the decision to stay local, stay at home, don't mix outside of their household. Because, I mean, everything that we're seeing today is that things that were a month ago or 2 months ago, a low risk activity, today are really high risks because of the level of COVID that's circulating in our communities. As it relates to our surge planning, Governor has it exactly right. We are less worried about the space in some of our facilities, although it's true, some hospitals are using every inch and area of space to take care of patients, and we commend that important use of those spaces. But certainly our bigger worry right now is staffing. A lot of folks look to the alternative care sites, which indeed are an important part of our response. But more than that is identifying staff, working with hospitals across impacted regions to make sure that they have the staff, either through registry and traveling staff, nurses and physicians and other providers, respiratory therapists, or some facilities bringing their outpatient staff to come help and serve in the inpatient environment. So all of those strategies help us ramp up our ability to take care of patients, both in regular hospital beds, in emergency room bays, and also in ICUs. So those collective efforts working directly with counties, as the governor mentioned, efforts focused specifically in Southern California and Los Angeles County to not just bring these staff, address issues of oxygen and ventilators, but also working to make sure that everything is as well coordinated as possible. Working with the California Hospital Association, our nursing partners, our other staffing partners, the California Medical Association, a number of these typical partners that you've seen us mention, really coming together now to make sure we put California's best foot forward, so that it's not just every hospital on their own, but really bringing together these regions, the efforts of big systems with smaller hospitals to partner to make sure that no matter where every Californian goes, they can get high quality care from staff that is, as supported as they can be anywhere in the state, so that we can ultimately save as many lives as we can.
And Doctor, just if I may, and forgive me, I'm shouldn't be the one asking questions, but you and we've had a number of conversations about staffing, particularly expectations on opportunities to see a modest increase in staff that first week of January from where we are today, just on the natural. Perhaps you can amplify that, just socialize a little bit of that, of what we're seeing in terms of the prospects of actually being able to access some more staff in the next week or so.
Yeah, Governor, really, really important point to amplify. We have been, working with both our own efforts to get staff into the state at the state level, but also the various hospitals that very routinely during this time expect hundreds, if not thousands, of what they call traveling nurses, traveling health professionals who go from place to place across the nation, across the globe to help support hospitals that are affected. We have not been able to get that reliable number up until now into the state. And just surveying a number of the hospitals, both big and small, our own state efforts, really looking in that first week of January, starting January 4th, where we've been told a number of traveling nurses, traveling health professionals will be arriving in the state. Some going directly to hospitals, others coming through the state and moving to various facilities that are deeply impacted. That will absolutely, as that comes through, help us not just make sure that we're able to staff some of the beds that today are available, but also open up additional beds so that our ability to surge is indeed as great as we anticipated.
Thanks, Doctor.
Kathy Novak, KCBS Radio.
Hi, Governor. Thanks for taking my question. COVID outbreaks are continuing at California prisons, with about 7,500 cases confirmed in the last 14 days, according to the latest CDCR tracker. Are you satisfied with the steps that are being taken to address these outbreaks? And what's your response to the continued calls for prison populations to be reduced through more releases because of these outbreaks?
Yeah, I appreciate it. Let me go to a slide here just to give you the current focused efforts. And I'll back up. We have 9,421 current cases, population plus or minus 100,000, just to put it in perspective. And obviously, we're not just monitoring CDCR, which is the California Department of Corrections, obviously monitoring the Division of Juvenile Justice. We're doing a lot better there. We have active cases that include not just inmates, but obviously concern around prison guards themselves. Here's the area that we focus most of our attention, and these are the top facilities, top in terms of their being high-risk facilities, top-of-mind facilities in terms of our efforts. San Quentin goes without saying, a lot of focus there. And we've seen cases range from anywhere from 2 to 6 in the last number of weeks. I think we went to 9 at one point, but currently 4 cases. You can see the other high-risk facilities, the number of current active cases, and this is where we are particularly focused. As it relates to the work on decompressing the system, and this goes to your specific question, we have reduced the census, the total population since March, by over 21,000 individuals, over 21,000. This is almost without precedent in California's history. And you can see some of the work we've done to do that, meaning we've looked on early release for what we refer to as non-non-nons, people that have X number of weeks, months left on their sentences, and those that are not serving non-non-nons, meaning not violent, not DV related, not sex offended. So there's a triage component to that. There's a coordinated focus in terms of risk assessment in that space, but there's also a suspension on the county intakes, which put a lot of pressure on the counties, put a lot of pressure on the sheriffs, and I want to just acknowledge that pressure and acknowledge their partnership. I respect and appreciate the challenges that are presented when you effectively look to suspension of intake. It's happened on multiple occasions since the beginning of this pandemic. We're also testing. We've substantially increased our testing protocols of staff and institutions, as well as our new aggressive mask mandates with now higher level of masks, meaning N95, not just surgical and procedure masks of inmates and staff if there's any even modest outbreaks. Again, we're looking at assessing medical risk, and I, on a weekly basis, without exception, spend hours and hours and hours going through the cases of each and every individual. I simply will not, en masse, release people without looking individual by individual at an assessment and protocol and process, and that's the latter part of your question. And so while I respect those that want to bypass protocols, sentences, victim notification, processes, procedures, and analysis, we are moving in a different direction than that. And we have been deliberative, and we have protocols in terms of capacity building within the system, in terms of isolation and quarantine, in terms of surge capacity that have come from the experience of San Quentin, that we have pre-positioned and we have pre-planned, particularly at those high-risk facilities, in order to address any subsequent outbreaks as we move forward. So a lot has been done in this space. We're very vigilant in terms of our focus and the monitoring of what is occurring in the prisons. And as you may have noted in the Plan 1C, or rather Plan 1B, forgive me, Tier 2 recommendations, there is some consideration for high-risk staff, rather high-risk inmates, particularly in skilled nursing facilities, and those that are particularly medically vulnerable that are in these settings that we will look as well to prioritize in terms of access for the vaccine. So that's broad strokes, an update. And I'm very pleased with our new CDCR director, the partnership with Clark Kelso, our health administrator, meaning the federal oversight. Mind you, the health of our prison system is being monitored by the federal government. It was taken away from the state many, many, many years ago. And we are continuing to build stronger partnership in terms of our efforts to advance our safety protocols within the system and to mitigate to the best of our ability the spread and ultimately get us through this third wave.
Jeremy White, Politico.
Hey, Governor, thank you again for giving us some time for taking my question. A lot of curiosity out there about the state's role in sort of enforcing this vaccine hierarchy as we get into the more complex, out of, sort of concentrated healthcare facilities and into this more diffuse process with all these categories. So can you tell us more about what role the state is going to play in sort of monitoring that and ensuring people don't skip the line? You alluded to staffing shortages and sort of working pharmacies to regulate the process. So how can we be sure that this is proceeding in an orderly way and people aren't sort of gaming the system in terms of the vaccine hierarchy?
Yeah, no, I appreciate the question, Jeremy. And we've been asking that ourselves for weeks and weeks. I think on at least 2 or 3 previous occasions during these presentations, I've highlighted this point of consideration and concern. And I also highlighted just a number of days ago, right before Christmas, our specific efforts working with the California Medical Association and others to look at protocols and processes to enforce and ultimately to hold folks accountable that skip the line. I just want to make this crystal clear. If you skip the line or you intend to skip the line, you will be sanctioned. You will lose your license. You'll not only lose your license, we will be very aggressive in terms of highlighting the reputational impacts as well. We are going to be aggressive here, but you are not wrong in the way you framed your question. As you move into these subsequent phases, as you're dealing with millions and millions of doses, you're dealing with hundreds and hundreds of points of contact and thousands of individuals. Not every individual may hold themselves to those higher ethical standards or the Hippocratic oath, which they've taken. And we are mindful of that. And so I'm not naive to the prospects that there are going to be some issues, and we're going to have to work not just as a state, but with our county partners to monitor that behavior at the local level, even at the clinic level, and to make sure someone's not passing a few vials over to their cousin or aunt or uncle, or God forbid, making a buck or two on the backs of a vaccine that should be distributed to someone who's at high risk or in higher need. And so we are looking forward to putting out details of what that enforcement package looks like, but I can assure you over the course of the last number of weeks, we've been working aggressively behind the scenes with a lot of our partners, as I say, including the California Medical Association, that is very, very desirous of making sure that their profession is not impacted by bad behavior and wants to encourage and process good behavior. We look forward to talking more about that when we finalize the details of that enforcement strategy. With that, that was a long answer, Jeremy. Let me just ask Dr. Galley, because I know he cares deeply about this as well and has been front and center in these good negotiations and discussions. Maybe he can amplify on a point or two as well. Doctor?
Yeah, Governor, you hit major points. I would just say that, included in some of the state's opportunities is obviously through our ability to look at licenses, professional licenses, but then also CDPH has the responsibility of enrolling every provider through our state system into the federal system that allows you to receive vaccine to distribute. And we also have the ability to disenroll providers when, in fact, any of these violations are flagrant enough that no longer can that provider, that place that's distributing vaccine, continue distributing vaccine based on those issues. So we have those steps, as the governor said, putting that together in a package that's transparent, clear, working with our local partners. Already there's been some conversations with local partners where questions have been raised I think the media has picked up on some of these issues already and working hard to make sure that one issue doesn't snowball into more issues, because we know that if it happens in one place, it could happen again in another. And we need to be very serious about this, because many people are looking closely, not just how we do it, but they want to know when they are rightfully due to get the vaccine and that fair and equitable distribution. In California, all across our government, all across local governments as well, take this very seriously and expect this to be an area of increasing activity in the days to come.
And Jeremy, at peril of belaboring our, I hope, was a comprehensive response and preview of those details being made public very shortly, I also just want to highlight it's one thing to be concerned, and we all should be concerned about a high-profile individual or celebrity that cuts in the line. I want to make sure that this frame on equity is also foundational, and that we put, the fact that we put together this scientific safety review committee, this drafting work group, and then this advisory committee, 3 committees, was advanced with the intention of a real commitment, a firm commitment, not a passing interest, but a firm commitment at looking at safety, efficacy, and equity. And that's the 3-legged stool here. And we have to make sure that equity component includes that distribution as intended, and that we are all held to a higher level of responsibility and in turn accountability in terms of not only rhetorically advancing that frame, but demonstrating that. And again, you make the point, I think, very, very well. It's one thing when you have a few 100,000 doses and you are focusing on a limited supply in a limited frame with healthcare workers and skilled nursing facilities. It's another when you're in January, February, March, and millions of doses are now distributed and locally available, and that distribution points increase, and that accountability now is spread more broadly, and the challenge of being more transparent becomes self-evident. So that registry is a big part of it, as Dr. Galley said, but these partnerships are going to be critical, and good faith. And again, just holding ourselves to a higher level of ethical conduct is also human nature, has to also be part of any successful enforcement in this space as well.
Final question, Aiden Vaziri, SF Chronicle.
Hi, Governor Newsom. I was wondering, when you look at this plateauing of numbers, is that an encouraging sign that the stay-at-home orders are working? And a follow-up to that is, as we move past the holidays and vaccines become more widely available, how bad are things going to get before they get better?
Well, it's a sobering question and an honest question. And I think one has to be honest in response. I think, it was wonderful, at least for me, to hear this from the president-elect when Joe Biden last week, right before the holidays, was assessed things, I think, correctly, that unfortunately will get worse before it gets better. And I think demonstrably that's the case. And not only as a nation, but clearly as we work through the next 60 to 90 days here in the state of California and anticipate this surge on top of a surge, arguably on top of a surge as it relates to the holiday movement and the travel that we've experienced all across this country based upon the data that has been reported. And so we are gearing for that. We're preparing for that. We're not wasting a minute, not wasting an hour, not wasting a day, not wasting a weekend. No time off on Christmas. There's no New Year's celebration in terms of that planning. It's very sober, and we're being very proactive and looking to build more capacity, more partnerships, and leveraging existing resources, which I hope broke through today in this presentation with the teams that we are inserting in LA County in particular, and looking at load capacity between hospitals, not just systems, not just within counties, not just within regions, in a different way to be even more prescriptive and supportive in terms of our preparation and our planning. As it relates to the first part of your question, I'm going to have Dr. Galley answer that, but my sense is yes, that people have taken seriously this call, and that, I say this all the time, in our line of work, unlike baseball, you don't get credit for saves, meaning we don't talk about what could have otherwise been. We just talk about what is, and we assess that versus maybe this would have been much, much worse had we not introduced some of these interventions. I think some lazily say, well, those interventions went in place and it didn't work. I completely reject that. And I suggest that there is evidence they have worked, substantially so. And that's encouraging. And I think that's certainly the case as it relates to these numbers that are plateauing. But Dr. Galley is the doctor for a reason, and he's more prepared to answer that, I think, more substantively than I am.
Well, Governor, as usual, you did a fantastic job answering it, but I will amplify a couple points. Absolutely, we have seen this plateau. It's what we'd hoped for. We weren't sure that we were going to see it because of some of the concerns around the movement, mobility data, our sense of where this was being effective and where it wasn't. And frankly, we're pleased to see a little bit of a plateau because the governor has it exactly right. If we continued to see the rate of rise through the last couple of weeks in the cases that we're seeing today, the impact that we anticipate coming from Christmas, New Year's would be even worse. And I'll remind you, we've learned so much about taking care of patients with COVID. We've learned how to treat them in hospitals, but when those hospital beds and those staff aren't available to provide care, then people don't get that care, and we have the worst outcome and more deaths than we anticipated. So the ability to continue over the next week to make the decisions, decide not to mix, decide not to travel, decide to celebrate virtually with others or with your household alone, those are going to be the things that help us keep this slight decrease downward or flattening, not even a decrease downward, just a flattening of the upward trends that help us anticipate a slightly reduced impact on our hospitals. All of that said, you asked where this is heading. We certainly anticipate that the middle of January is going to be a pretty difficult time in our hospitals, where the cases from this week and next week really start to stack on top of one another, impacting the emergency rooms, our hospital wards, and our ICU spaces. That when I speak to hospital leaders throughout the southern part of the state, they are worried about the middle part of January, the second part of January, as being the major areas of impact. And although we hope to get more staff in, as we talked about next week, and that we have these beds prepared, we also know that a number of Californians are worried. We've seen that in their behavior. It's both the regional stay-at-home order's impact, but also impact from the fact that I think people are worried about what they're seeing in our hospitals. They believe more than ever that that could be them, that could be their family member. Hospitals, not just with 60, 70, 80-year-olds on ventilators, but hospitals with 25, 35-year-olds on ventilators who aren't doing well. So this is really a call to everybody, not to say, well, what's happened in the last couple of weeks? Has that regional stay-at-home order been as effective as you thought? Like the governor said, we've gotten something out of that. The trends have started to come down a little bit, but it's not enough. We need people not to let up their guard, to take this as seriously as possible so that we can get through the middle of January, the end of January, continue to get the vaccine out into our communities, get the most vulnerable vaccinated first with a lot of our high-risk frontline workers, and then into those first couple of months of the new year and really feeling more confident then. But right now, it's time to stay laser focused on what we can do in the next days to come. Because as the governor has said many, many times, we're in charge of the future. We make decisions today to not just save the lives of our family members, but our communities at large. So I think that's what we see on the horizon. It isn't already set in stone. We actually have some decisions to make that are critical over the days to come, each and every one of us.
Here. Appreciate that response. Appreciate the question. Appreciate all of you for tuning in, taking the time, and we look forward to making updates tomorrow, Wednesday, the rest of the week, and obviously work our way through the next very challenging month, as Dr. Galley summed up, I think, quite well. Final point, just point of clarification. Yeah, I think, Don, you asked, and I didn't answer, forgive me, tested multiple times, negative. I can't even recall how many. And so that's my testing status to the extent anyone cares. Anyway, look forward to updating you very shortly. Again, hope everybody stays safe and does what they can to mitigate the spread of this virus during this very, very challenging time. Some encouraging early signs that we may be plateauing in many parts of the state. Very, very sober reality in certain parts of the state, particularly Los Angeles, Riverside, and San Bernardino County. We'll take care, everybody, and we'll look forward to circling back and updating you the next day.